to Energized Thinking. We are so excited to have our next special guest with you, Katelyn Carey. Katelyn's background includes 20 years of acute care nursing, clinical leadership, and medical education. She has worked in everything from search and rescue to ICU and hospice. Katelyn's hobbies include Irish pub singing and picking fights with outdated medical practices. She uses her experiences in leadership positions and at the bedside to put a personal spin on the science and studies that can become actionable tools for better communication and connection. Thank you so much for being with us today, Katelyn. It's an absolute pleasure.
Thank you so much for inviting me. I am thrilled to be here with you all.
Katelyn, I really feel like you are just the perfect guest for Energized Thinking because we talk a lot about learning, critical thinking, curiosity, and we also are just a bunch of girlfriends talking about real things. And I would love to hear your thoughts on, why is learning important? Why is curiosity important to you?
That's a fun question. The people that I most want to hang around with are those people who have managed to maintain a mindset of being an always student, where we never stop learning and where we catch ourselves in those moments of thinking, oh, I know the answer to that, and close off our thoughts and our willingness to take in new information. I think we've all had times when we thought we were right, and then the right piece of information filtered through, and we've had to adjust our stance. And human beings aren't comfortable with uncertainty. We love to know the right answer. So it's by far and away the harder thing to do, to think, I've got more to learn on this, no matter how much expertise I have. But my gosh, it makes us so much more interesting and so much more connected.
I know Katelyn from our healthcare summit, and it was such a wonderful session that you had, especially when you talk about the blowfish zone, which is completely mind-blowing, that how we actually react when we are in the blowfish zone and what steps need to do. So tell us a bit more about this again, because I know that our audience would love to know more about this.
So the blowfish zone is an easier way of thinking about fight or flight. Think about it this way. You've known what it's like to suddenly be in a situation where things are going okay, but then suddenly they're not. It's getting a little bit more stressful. It's getting a little bit more emotionally intense. You're feeling threatened, or you're feeling challenged, or something triggers your outrage button, and suddenly you become spiky and hard to deal with. And we've all faced people who are in that place where you're talking to somebody who's maybe been out in the waiting room for an hour and a half waiting to see a provider in the healthcare field. This is a great example. And suddenly they lose it and they're screaming at the receptionist. In both cases, this is blowfish mode. And the important thing to know about blowfish is that blowfish isn't listening. Blowfish cannot listen. When we go blowfish mode, when we go fight or flight or amygdala hijack, however you think about it, what happens is that we actually shift our processing from our prefrontal cortex, our critical thinking brain, to our amygdala, which is our instinct and our feeling brain. And yet, how often have you tried to have a logical conversation with someone in blowfish mode? Or have you ever had, when you're really wound up, somebody tell you, calm down. There are certain things that do not work when we are in the blowfish zone. People correcting us, people directing us, and critical thinking do not work in the blowfish. So in a nutshell, that's what blowfish is.
Yes, I mean, that's like it. Yes, you just mentioned that, how we are in the blowfish mode. We do not think logically, rationally, and we're just, in the fight or flight mode. So just tell us a bit more about it, that how we can deal with people who are in the blowfish mode. Or you can also just say that how, if we are in the blowfish mode, how we can deal with our own blowfish mode.
Yeah. So the rules, the answers are the same, but the relevance, I think, is much more than we give credit for. So the relevance of blowfish mode is that if you're talking to somebody who cannot listen, then we have to pause. We have to pause and realize that the rules are different. I asked somebody who was an experienced ER nurse, and I used the example of, okay, 37 people who worked in this ER, 2 of us were willing to go out to the waiting room and update patients. Because inevitably what would happen is somebody would completely lose it. And in one example, walked out to a guy who's yelling at the receptionist. He's there with his mom. And as soon as I step foot in that waiting room, he looks at me and says, "You said she was going to be seen an hour ago. It's been 2 hours. What's wrong with you? Can't you see she's sick?" What do you say to this guy? Take a guess. What would you say?
Like, my initial reaction is to say, calm down. Like,
Right? And if we do that, then the next thing we're going to do is we're going to call hospital security, because the situation did not get better. The situation got worse.
Yes.
Yeah, so true.
Give me another guess. What is your first thought of what we do?
Yeah. First of all, like, especially in that situation, what we can do is we need to connect, kind of a connection with that person, that instead of like, just saying calm down or something, and just say, I mean, that is something that, like, I recall doing this, because when I was heading a call center, and that's how we usually handle like angry callers. So what we need to do is say, okay, you're right. First of all, you need to make them calm down in a way to just reassure that you understand their problem. To create an empathy connection, and they say, okay, you're right, we understand the situation. And then, of course, you just say, we take care of your problem, instead of telling that why we are doing this. Because most of the time people get into the mode when somebody just say, you are wrong, and they are in this like blowfish mode, we get defensive. And when we get defensive, we try to just put all the like fences up and just say, okay, we need to defend ourselves, instead of understanding the problem. So what we need to do is we need to create an empathic connection, and we need to, instead of just trying to justify why we are late or why we are having this problem, think in terms of their perspective. Say, okay, we understand if your patient is sick, and I'm going to take care of it. And then it's just going to, and after that, you can just say, okay, we have this problem and this. But first of all, you need to connect, and you say, okay, I heard you, and we are on the same page. We will work out to, like, just make them on the side and say, okay, we'll work out together to find out what the problem. So I think that's would be my stance.
And Ambreen, you nailed it. But I'm going to take what you just said, and I'm going to simplify it down to its basic little pieces, which is that anything that we say that is defensive, corrective, or directive. So you're right. We have an instinct to justify ourselves. Well, we did tell you it was going to be a long time. Or we have the urge to give more information. Well, sir, we can't take you back right now, because here's how it works. First, we take people who are the most critical, and then we work our way down through triage, and that's because of da-da-da. And all of these things are going to make this situation worse. What makes the situation better is understanding that, yes, I am facing someone in the blowfish zone, and therefore I need to deflate the blowfish. I need to reestablish safety before I can give him all the rest of that information, because I can tell someone, yep, I know it's a long time. We said that at the beginning. We didn't know it was going to be this long. I can tell that's when he's calm, and I'll get a totally different reaction. I can explain the triage process. When he's calm, I'll get a totally different reaction. But what we forget sometimes is that we do have to pause and deflate the blowfish. We have to reestablish safety. And what you just described is, I see you're upset, and, can you tell me what you're most worried about? You're worried your mom's going to get worse if we don't bring her back right away. Okay, well, I can't bring her back right now, but I can reassess her in the triage area to make sure she's safe to wait a bit longer. You're not necessarily fixing the problem, but you are addressing the threat and helping to reestablish a sense of safety. The 3 rules I like to say that trigger our blowfish response is situations that are high emotion, low control, and overwhelmed coping. And with those 3 triggers, therefore, that's our response as well. What can we do about the emotion? Well, we can reassure. Ambreen, you said that. What can we do about the control? We can give a control step back. Hey, you know what? You know your mom better than I do. So if you see something that's changing, and you're newly concerned that things might be getting worse, come back up to the reception desk and ask for her to be reassessed in the triage area. And then that overwhelmed coping, anything that we can do to help people reestablish their coping. And sometimes that's just by helping them name what it is they're feeling.
I was just gonna say, like, just to follow up on that, Katelyn, I think that's so like simple yet so hard sometimes, but it is so needed. And I just remember in healthcare or in education or in any setting that we ourselves do not feel safe for whatever that is, for whatever reason, our amygdala or whatever, like we're triggered from some reason, that safety is so important to reestablish. Like, I remember in particular when a nurse hugged me when I was really feeling just kind of I didn't know what was going on in the situation or in the classroom. Like, if I think about with kids that maybe, I'm just kind of thinking about Barbara Vokatis. We talked with her recently about dog therapy in the classroom and kids feeling safe with dogs. Like, I think that safety is so universal, yet we don't talk about it as much. And I love how you're bringing that up and kind of making it so simple and into the blowfish zone. Like, when we have too many blowfish swimming around, and we need to deflate the dang blowfish, both in others but also in ourselves.
Well, and Valerie, you, after hearing one of my presentations, proceeded to use the word, and then I blowfished, and I'm like,
Oh.
yes, it's a verb. But you're right. It's made me so happy. But it is. It's a simplified way for us to think about and to talk about these reactions that are actually very uncomfortable and intimidating. And Courtney, I'm going to throw this next part to you, which is that you asked about, well, what about when we personally blowfish? So think of a time when you were personally blowfishing, and I'm going to put it in an even more kind of uncomfortable category. Let's say you're blowfishing because you really screwed up something. What is, in that blowfish moment, where are your thoughts? What do you think your internal voice is telling you at that time?
I think this is such an interesting concept, and it kind of goes back to like what Valerie was saying. Your initial reaction is to become very defensive and to project that. Not like initially it would be very direct, but then at the same time when Ambreen was speaking, it's instinctively that you should calm down first before you speak. And I think that obviously comes with maturity, and it depends obviously what age we're speaking about. I know Valerie was mentioning even in classrooms with Dr. Barbara Vokatis, but I think that initial reaction is defensive, but I know I need to take a deep breath. I need to relax first and assess the situation. Admit if I did make a mistake, but an initial reaction, I don't know if that would be your initial, like, no, but this happened, and then that's why I reacted this way. So I hope that answers it.
Or instantly critical. And here's the thing, think about what your inside voice is doing at that moment, because if this is something that you screwed up or somebody else screwed up, your voice is still going to go critical. Oh my God, I'm such an idiot. I messed it up again. How could I have done that? Whether you're saying that to somebody else or you're saying that to yourself. So here again is this pause. Don't continue the conversation. Don't ask yourself to try and not be defensive and instead, offer an apology. Pause and reestablish safety. Maybe that looks like, you know what? I can't have this conversation right now. I'm not going to forget it. I'm going to wrap back, but I need a little bit. And then you take yourself outside and you just take a walk through the grass for a few minutes, or you pour a cup of coffee or a cup of tea or a glass of ice water, and you just focus on the sensations and take a few breaths until your body recognizes you're back in a safe spot. Now you can access those parts of your brain that think critically and can bring you to that either kindness to yourself or kindness to others' space. But we can't do it sometimes when we're in the blowfish zone. We have to pause.
It's like when I was just thinking of, I had some guy upset at me for like, I don't even know, some random thing of a parking, like in a parking spot. And like, I initially was like, oh, and then I was like, sir, this is a beautiful day outside. Have you tried mindfulness?
That surprised him. Did it surprise him enough to push him out of his blowfish zone? Because it can. Did it?
Yeah, so it's like that logical. I'm like trying to be logical, but yet still on blowfish. Oh, anyway.
Well, and so on a small interpersonal level with one another, this makes such a difference for our relationships. Understanding that blowfish mode, I'm going to step away. I'm going to take a second and I'm going to just recover myself before I attempt to have a conversation that's critical thinking. But on a broader scale, this is playing out on the political fields where we're trying to correct the other side and tell them why they're wrong, but we haven't paused long enough to identify their threat. Why are they in the blowfish zone? Why are they having a threat response? And until we understand that, we're never going to accomplish common ground. And Valerie and I were talking about, the fact that sometimes being on your phone can just make you feel icky. Mm-hmm. And we go back to it because it's an addictively programmed device that's meant to pull our engagement in repeatedly. But with the amount of news feeds and things we're getting, we know perfectly well that the best way to capture a human being's attention is through outrage. And outrage brings in this guy. Outrage brings back in the blowfish zone. And as soon as we're in blowfish zone, we can't listen. Mm-hmm. And so here we are outraged, and us making those clear delineations between us and them. Because the more fearful we become, the more outraged we become, the more we hunker down with our tribe because it makes us feel safe. And the less likely we are to be able to take outside input and absorb and think critically. We have to pause. We have to reestablish safety. Blowfish isn't listening. Blowfish can't listen.
It's just coming to my mind. I mean, I know that especially in certain relationships, there are certain, especially in family relationships, when maybe you have a mother or maybe a mother-in-law or whatever, like the relationship could be, maybe a friend who are constantly in the blowfish zone, right? Maybe they are triggered by our whatever, like our personality, right, or anything, or our energy or something. So what you recommend, how to deal with that person, like with whom you cannot avoid, whom you cannot sometimes take a pause, you have to react. I mean, in like maybe, especially in the family, I would just say, because maybe even you're there, if even they can trigger by in the presence of so many other people, and you know that they are blowfishing, and you can't take a pause. And you have your rational thinking and everything, and you know that, but you have to like act spontaneously, and at the same time you know that you cannot trigger them more, but whatever you say, they're going to trigger anyway. So how to deal with that situation?
Ooh, that is a nicely complex question. I love that.
Yes.
So I'm going to give two different answers. The first answer is a broad answer, and the second answer is a specific answer. So the broad answer, in part, is remember when you're thinking about establishing safety, when you're thinking about deflating the blowfish, that we are action-minded, and the more stressed we are, the more programmed we are to act. So this is a threat response. Threat responses demand action. Sometimes that's running away. Sometimes that's attacking. Where we then forget, because we are prone to action, and then you have two blowfish, and that's just never a good thing, is that don't just think about what we can do to bring about control and safety. Think about what we can stop doing. So sometimes, with the example of the phone, that means you put down your phone and you step away. They've done research where they talked about taking yourself off social media for 30 days is equivalent to putting yourself in full-time counseling for a month in terms of the results on anxiety and depression and stress. And that's pretty profound right there.
Yeah.
Now, when you are in a place where you are forced into an interaction space where you have to be talking to somebody and you know they're starting to hit blowfish, you're starting to hit blowfish, a little tiny bit of distancing goes a long way. Again, keeping yourself out of the blowfish zone. And there's a lot of different things we do for ourselves mindfulness was brought up. Mindfulness exercise is fantastic because that's your observer brain who can go, oop, you're starting to blowfish a little over there. How about let's calm down and put an intervention in place. And you put something in place as an intervention that you know helps to remind you that you're safe and helps you to stay a little bit more calm in the moment. But the biggest intervention we can do with other people is compassion. And here's what I mean by that. Compassion asks questions. So to that guy in the waiting room, I see you're upset. What are you most worried about right now? Ask that question. When you see somebody getting worked up, recognize, label the emotion so that they see that you're seeing that same threat that they are. And if you get it wrong, great. That's a chance for the other person to correct you. That's not what I'm feeling. I'm feeling this. Oh, okay. You're feeling this.
Yeah.
Yes. Tell me. I'm not sure I understand, but I want to understand. Can you tell me what you mean by that? Can you tell me what you're most concerned about? Can you? And the more you ask questions, you're doing two things. First of all, you are showing them that you see and recognize their threat, which is helping them to step out of that blowfish zone and feel like you're now part of the us. If you understand me, now you're part of the us, not part of the them. And the whole situation kind of de-escalates. But the other thing that you're doing is the more that we use language, the more we actually poke holes in this barrier that comes down between amygdala and prefrontal cortex. So language use is prefrontal cortex. It's not amygdala. And so the more that we have to use language to describe what we're thinking and we're feeling, the more we kind of tap down the amygdala by default. Valerie, with her mom's focused piece of things, is a good one for this, because if you think about a child who is just losing it, one of the most effective things you can do is kind of give them the emotional comfort and safety and then label their emotions. I'm sorry, sweetheart. I see that you're feeling frustrated. This looks like it's a really overwhelming, disappointing situation right now. Are you sad because of ... And if you can get them to speak, and if you can get them to answer and start using words to describe where they're at, they will automatically deflate their blowfish.
Labeling them and just make them realize, it's really fantastic way to actually deflate their blowfish. Thank you so much for this. And I'm sure it's gonna help a lot of people who've been dealing with these kind of blowfishes around them. So, yeah, thank you.
Yeah, pause and establish safety.
Yeah.
Courtney.
Just gonna say, I love this analogy because just as our conversation has gone, obviously you have an extensive background specifically within medical, obviously as an acute care nurse, but this applies to real world, just like Valerie was saying, in a parking lot, speaking to a stranger, classroom. I honestly think that this topic should be taught at young ages in classrooms, how we emotionally regulate, how we, in those high pressured situations, or if it's, interpersonal communication, if there's a slight argument that comes up, how do you react? Because there's so many times when I reflect back to your very point when you were speaking about just taking a breath, just saying, I can't finish this conversation right now. Wow. What a world of a difference that could probably make in so many people's lives in different contexts. So I love this conversation that we're having. And as I mentioned, just reading your background, it's absolutely incredible. You have also done TED Talks. So we would love to hear just your experience, your journey in doing these and conducting these TED Talks.
I tend to get these wild ideas and then I geek out on the science. I like diving around in cognitive science and trauma science fields. And I'm having been in the medical field for 20 years now and always dealing with acute care. So I started pediatric and neonatal intensive care unit at a children's trauma hospital. And then I went to 13 years of ER. And then I ran a new grad residency program for ICU, CCU, and IMCU. So, and then I moved to hospice just, to round it all out.
There you go.
So bedside life or death conversations all the time, and a lot of experiential, anecdotal stories about what worked and what didn't in those conversations, what caused us to either connect so strongly and have something be beautiful even in the face of stress, and what caused it all to break apart completely. So it started with anecdotal observations, and then it moved to what is the science behind it. And the first TED Talk that I did was because I had accidentally written a medical resource book. It doesn't sound like one should be able to accidentally do that, but it was supposed to be a trifold brochure, okay?
There you go.
It was supposed to be a trifold brochure that addressed the fact that breast cancer information was way too intimidating. I'd gone through a preventative mastectomy when I was 29, single, dating, world's most awkward dating conversation. And I'd been very unimpressed as a new nurse as well as a patient with the information. So ended up creating a better resource for breast cancer patients, a book called Beauty After Breast Cancer. And as the years went by since creating that resource, I thought, you know what? The number of people who participated, there are 37 people in the book, all showing bare-chested portraits of what real surgeries look like on real people present in life beyond the cancer diagnosis. And they were so astonishingly brave in sharing the things that were most useful to them, the things they most needed to know to step back into a strong sense of self again after their diagnosis, the things that they needed to feel confident in their body again or to have the information to make a surgery decision. And I wanted so badly to bring that project a little bit more public through a TED Talk. And I took the book project and I took an idea that I had explored through the medical system, which is that we are so hardcore about empathy. You know, oh, empathy is, the end all, the be all, the perfect connection tool. And I was watching in healthcare as I would go and give somebody a cancer diagnosis. And then I would tell them that I didn't think that, or I would talk to somebody who was there for the 10th time in an overdose situation, who was looking for additional resources, and we didn't have any more. And then I would tell a parent that their kid might not be pulling through this last injury. And I'm sorry, but if I empathetically put myself in the shoes of every single one of those people, I am going to drown. It's called vicarious trauma. When we open ourselves to put ourselves in somebody else's perspective, that is a raw and vulnerable place. And hopefully that'll unfreeze on itself because that's a super flattering picture. There we go. That's a raw and vulnerable place. And there is a difference between an empathetic approach and a compassionate approach. And in a nutshell, it boils down to this. Empathy is not appropriate for situations of high emotion or high complexity. Because when we put ourselves in someone else's shoes, in an emotionally intense situation, that is akin to jumping in the water with a drowning person. And if we put ourselves in someone else's shoes in a complex situation, what we're likely to do is come up with the answers that would work for us if we were in that situation, not the answers that would work for that person if they were in that situation. So empathy is not the right tool for high complexity or high emotion situations. The difference between empathy and compassion is that compassion actually stays on the dock. Oh, that person's drowning. I need to help them. And instead of jumping in the water with them, to be, emotionally present with them and experience what they're experiencing and then make a judgment call, instead we intentionally take a half step back and go, you know what? Do I recognize what the problem is? Okay, yep, I recognize the problem. I've clearly identified the issue. What skills or knowledge do I possess that would make this better? And then we reach to the side and we throw a life preserver while we're simultaneously yelling for help. Compassion still cares. Compassion wants to help, but compassion does not jump in the water. So empathy versus compassion in the breast cancer story was the first TED Talk. Blowfish was the second.
I love this. I love the difference that you speak about with empathy and compassion, because I've never really thought of it in that situation, or in high pressured situations where emotions obviously are running, but to be able to think logically, because there's been times when I've been put in situations where my first thought is just so irrational. Like you're not thinking straight. Like you said, you want to dive right in, but I really do. It just, as you're speaking, I'm just kind of digesting and even reflecting upon certain situations that I've had where if only you just take a deep breath in those moments, it's hard to do. But to act more so with compassion. I really like that because I never had thought through the true difference and the different situations where empathy would be still useful, but then really where compassion takes over in very high intense situations. So thank you for that, Katelyn.
And the rules are the same as with the blowfish zone. Compassion asks questions. Compassion cares, and compassion asks questions. So rather than jumping in, I'll give you an example. A friend of mine with stage 4 cancer. She got the news. She's a parent of young children. She told a friend of hers what she just found out. And the friend answered with, well, I just want you to know that when you're gone, I will be there for your family. And she's like, thanks for writing me off. And she was just ticked. It did not restore connection or accomplish a connection. It broke it. But that person was actually giving an empathetic response. She put herself in her friend's shoes as much as she could, and she went, oh my God, what would I want to hear? And she spit out the first thing that she thought might make her feel better, or the first worry that she had, which was, what about my family if I were gone? And so she spit out this answer to her friend, but it was the wrong answer. The best answer that person got was oh my gosh, I wish I knew what to say. Is there, can I help in any way? What would make you feel better right now? Or back to that same question, what are you most concerned about?
I think that's so true. Like when you stop and you reflect about like asking a question, because, especially too when I think about when there has been a death, it's like anything that you say is not ever going to make it better. And so the fact, like you said, to be able to ask questions, how can I make this better in the sense like I'm here for you. I'm here for you in this situation. But finding the right things to say during those, it's a very vulnerable moment. Like you said, nothing you really say is going to solve or make it better. But I really do. I like how you say, like, ask questions, because then it makes them reflect as to what their needs are in that very vulnerable moment. So I love this conversation, Katelyn. I'm like in it. Let's do it for 2 hours here.
Sometimes the best thing that you can say when you don't know what to say is, I wish I knew what to say right now. I love you. I wish I knew how to make this better.
So
And
true.
I want to add in this, like, especially, when people are overwhelmed with those emotions or something, and you don't know how to fix it, it's basically, they don't even need an advice or something. Like, if there's something, you just need to be there, and that's it. You maybe just need to offer your shoulder to something of that sort. It's just
Ambreen,
you need to be there. Yeah.
You pegged a question that can save relationships across the world right there,
Yeah.
which is that pause of, do you want advice or do you just want me to support you right now? What is most helpful? If we can pause and ask that question, we can save relationships around the world.
Yes.
There you go.
Absolutely. I love that. Exactly. Yes. Because most of the time, even like, I used to have this initial, like when I was very young, like, when people were like, see them, they're suffering or something, I used to give them advice, don't do this, and you can do this better or something. And people used to say, oh my God, because they never wanted an advice. And, my advice was, no matter how precious it could be, or no matter how apt it could be, but they were not appreciative. And then after I realized that I need to keep my mouth shut, no matter what, no matter how much I know the situation, and I know that sometimes my advice could help them. But if the people are not in the mode of taking the advice, there is no point of giving them advice. So this is the lesson I learned over the years, that that people don't need advice. People just need you to be there and just to listen to them.
Yeah, need to feel safe and need to feel loved. Help keep them out of the blowfish zone. We all spend too much time there.
Do you have
That's
a
neat. Our friends
fish?
out of the blowfish zone.
Yes,
Yeah.
love that.
What would be the, so there's the blowfish for the fight or flight. Now, when you feel safe and loved, what fish or marine life would you be that?
Marine
I mean,
life.
there's the deflated blowfish, but is there another, like, trying to think of like a cuddly thing?
My fish analogies tend to stick to blowfish and dolphins.
Dolphins.
A dolphin. Okay,
I
yeah.
don't
I
know which
like
one
it.
would be the friendly fish. The blowfins actually, the dolphins actually are not the friendly fish. I
No,
found a
they're kind
video
of jerks sometimes.
that is young male juvenile dolphins that purposefully taunt and inflate the blowfish, and then they play with them. They throw them around,
I
they
didn't
play
know.
ball, they chew on them, and BBC scientists are thinking, we actually, and once they chew on them and get them to release a little bit of the toxins, they're getting high off of it. So now the next question is, who are the bully dolphins in your life?
Yes.
Uh,
It's like,
Yes,
I feel
that's
like that's so
who are
applicable.
what? Are the ones that just poke at you until you inflate and then play with you
Damn
for entertainment
dolphins.
purposes when you're all, all puffed
yeah.
up.
I love that.
Oh man.
And
Yeah.
to that effect, it's not the dolphin's fault when it puffs up in that scenario. And we could be the
Yeah.
most self-actualized blowfish in the entire world. And when the dolphins chew on us, we're still gonna puff up. Okay, it's not your fault that your blowfish response is triggered by circumstances and bully dolphins.
Mm-hmm.
There's a whole lot of science out there that teaches people exactly how to trigger a blowfish response. Now, oftentimes, blowfish happens because we're just living in such an overwhelmed state. We're not meant to absorb the amount of information that we're absorbing. We're not meant to be so rawly open to emotions and bad news from around the world. And yet, because we're programmed with our survival brain at our core, this is Paleolithic programming that has been in place for millions of years, we're not going to suddenly reprogram ourselves just because in the last 100 years our threats have become more abstract than physical. We're still having a reaction that's based on millions of years of evolution, and that's not going to change anytime soon.
Mm-hmm.
But you have the agencies that are manipulating that. Sometimes it is that troll on the internet who's just like poke, 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 chew, 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 chew. It's the bully dolphin. Sometimes it's media triggering outrage, or the fact that all of these stories that come through from the news aren't sharing the heroes, they're sharing the villains. It's because we are programmed to focus more on negativity and threat, because innately the blowfish response or fight or flight is about threat response. So of course that has a louder volume to our internal processing, but the result of that is that we're having our attention captured by stressful threat input on a regular basis every single day, and we are not designed for that. We're maybe designed to go blowfish a couple times a month, not a couple times a day. And yet that's what's happening because Paleolithic programming is running into modern conflict with the way that we've set up our lives. What does that mean? It means we need more safety in our lives.
And another interesting, like I'm just kind of thinking around along these marine parallels, but like with, I feel like we almost need this call to like be more like a starfish in a sense where, I think those are just fascinating creatures that like, remember one time like my kids and I saw one on the beach and it was broken. We thought like it was missing an arm or missing a limb or whatever they're called. And like my kids were like, "Oh, it's broken." But then when we looked it up, they're actually regrowing something, and I think that's like so much of what like society needs, or like when we feel the shame. So I know like I felt shame in the moment, like if I had a blowfish response, a blowfish reaction, I feel that shame, and just kind of remembering that, okay, well now we have new information, or now I can like take that pause and I can be more like a starfish in the sense of like regrowing something that's, like, and I think that's what we kind of need in society of like, here's this information and what can we do with that? And how can we do something different with all these blowfish and these dolphins playing with us and all that.
Well, and
But
yeah, I love that, that's our regeneration phase. And we do. We
yeah.
need a regeneration phase, a place where it's quiet, a place where we can focus on growth, a place where we can be safe and just focus on our own healing. I also give the analogy of putting the little blowfish in a dive cage, where he's safe from the bully dolphin around him. What is your cage made out of? Or in a completely non-marine metaphor, think of it like a candle. You're holding a candle and you walk out into a rainstorm, and the raindrops are falling, and some of them are hitting into the wax and just causing a splash and a guttering, and some of them are almost hitting the wick itself, and there's a breeze going on, and it blows the flame sideways, and then it recovers a little bit. Is it the candle's fault if it goes out when it's sitting there in the middle of a storm? It's not. It's not. It can't help but be affected by the surroundings, and neither can we. So put that candle in a lantern. Hurricane lanterns exist for a reason. What are your safety measures? What are the bars of your dive cage? What are the walls of your lantern that keep you protected from all of the chaos that's around you and make it less likely for your flame to gutter out or your fish to blow up?
I love that. Oh, I love that sound effect. That just, it was like a great mic drop there. Well, Katelyn, I absolutely love talking with you. I think you just all of your analogies, your ways with words are just incredible. I would love for you to share with our listeners where they can find you, where they can learn more, where they can watch your incredible TED Talks, and please share whatever else you would like to for anyone who's listening to this recording.
Great. The TED Talks, you can just plug in my name and hit TEDx, or you can plug in my name and put blowfish or empathy, and you'll pop up the TED Talks. All of those things, plus some additional resources, are also available on my website, which is just KatelynCarey.com. And of course, I exist on LinkedIn and all those places too.
Yeah. And what one piece of advice would you like to give our audience today, so they can either protect themselves from being a blowfish, or and as you said, I love that analogy of like protecting the candle from all the chaos. So what one piece of advice would you like to give to our audience today?
Compassion. Compassion cares. Compassion asks questions. It is okay to do that for yourself too. I think that if we are being compassionate to others, compassion starts at the ground. So when you are blowfishing, when you are not, how are you talking to yourself? Are you, God, I'm such an idiot? Or are you like, well, that did not go as planned, and okay, I know I've got the ability to pull this back together. So that compassionate self voice will help us to practice that compassionate voice to others. And then I'll just root it right back to what your show is all about and where we started, which is maintain curiosity. We don't know. We don't always understand. And when we take the efforts to do, we make ourselves safer, and we make other people safer, and we make connecting and finding common ground possible.
It's beautiful.
Katelyn, I love this conversation. I mean, all these questions that have been asked from Ambreen to Valerie, the insightful thought process that has made me reflect on exactly what you're saying when it comes to curiosity. But in those high pressured situations, or in those very vulnerable situations where you're able to breathe, to take a step back and to ask a question versus, like Ambreen was saying, you don't always have to give advice. I think it's profound, because when you're in those situations, like I said, there's been many times where I just don't think, like the first thing that comes to my mind, I will say, instead of just pausing. And the difference that you spoke about with empathy versus compassion, that is profound. To me, it's really when you are put in those high pressured situations that you have to be very mindful how you come across, but to take time. Nobody's rushing you in that moment. And I think that's what we forget sometimes, is that you have to say something right away, or you have to react right away. But to actually just calm down and to reflect And so I just love how you even made me reflect. I mean, one of our first questions you were asking me, I mean, really made me critically think about a question that you were asking me, but critical thinking, curiosity, empathy, and compassion. Thank you so much for providing your insight. And what Valerie was saying, your analogies are, I mean, spectacular. I love relating to analogies. I mean, Valerie does excellent analogies herself, and so we're so grateful to have you. I just wanted to close out my side here.
Oh, thank you. Yeah, no, as may be evident, I'm a very visual thinker. So
I love it.
Love it. Well, thank you so much, Katelyn.
Thank you so much. It was really fun conversation. I was really insightful and thought-provoking. Thank you so much, Katelyn.
thank you. And just as a final reminder, if you're curious about either of those ideas, or you want to cement the concepts or some of the strategies a little bit more, the TED Talks are a great place to go to explore those concepts more. And I give some additional tools there that we didn't talk about today. So
Absolutely. Looking forward to it. Thank you so much,
yes.
Katelyn.